day, everyone, and welcome to this lecture. I'm Associate Professor Ivana Dodig from the Department of Neuroscience, University of Split School of Medicine. Today, we will discuss interesting sleep disorders, parasomnias, and movement disorders of sleep. Have you ever experienced sleepwalking, night terrors, or nightmares? If you did, imagine frequent occurrence of these symptoms. This is experienced by patients suffering from parasomnias. The term parasomnia itself is derived from the Greek word para, meaning beside or along the side, and the Latin term somnus, meaning sleep. Parasomnias are abnormal motor, verbal, or behavioral events and psychological experiences occurring during sleep, sleep-wake transitions, or partial arousals. They appear as a manifestation of central nervous system activation, which is then transmitted into the skeletal muscles and autonomic nervous system components. Parasomnias are more prevalent in children than in adults, and they can occur during both non-REM and REM sleep. Thus, they are divided into non-REM and REM-related as well as other parasomnias. Non-REM-related parasomnias include sleepwalking, sleep terrors, and confusional arousals. In sleepwalking or somnambulism, episodes of walking or performing other complex behaviors occur with no awareness of surroundings while in a deep sleep. These episodes usually occur in the first third of the night. Sleep terrors or night terrors are characterized by sudden episodes of intense fear, screaming, and autonomic arousal, such as rapid heart rate and sweating during non-REM sleep. Patients often do not fully wake up and have no memory of the event. In confusional arousals, patients have episodes of confusion upon awakening, typically from deep sleep, without full consciousness. Patients are disorientated, slowly responding, and have memory impairment. This disorder is common in children and can last several minutes to hours. REM-related parasomnias include REM sleep behavior disorder and nightmare disorder. In REM sleep behavior disorder, patients are acting out vivid dreams with vocalizations and potentially violent movements due to a lack of normal muscle atonia, which normally should occur during REM sleep. Symptoms might include violent movements, shouting, and potentially injurious behavior. Nightmare disorders are characterized by recurrent distressing nightmares that are impaired during sleep quality and daytime functioning, typically occurring during REM sleep and leading to full awakenings. Other parasomnias include exploding hand syndrome, in which patients have a perception of a loud noise or explosive feeling in the head during sleep onset or awakening, and sleep neurosis or bedwetting with involuntary urination during sleep. Accurate diagnosis of parasomnias is crucial, as they can be easily mistaken for other conditions such as epilepsy. Furthermore, the impact of psychiatric disorders on the presentation of childhood parasomnias should be carefully considered. Paroxysmal non-epileptic behavior and motor episodes in sleep are encountered much more frequently than their epileptic counterparts and can lead to unnecessary therapeutic interventions if not properly identified. Diagnostic approach starts with taking detailed patient history, including sleep patterns, behaviors observed during sleep, and associated factors such as stress or medication use. Also, bed partner or family member reports are often important for identifying symptoms. A whole-night polysomnography is performed as a crucial part of diagnostical procedure. Sleep diaries, actigraphy, and questionnaires and scales such as Epworth Sleepiness Scale, Pittsburgh Sleep Quality Index, and others can help assess and evaluate parasomnias. Effective treatment of parasomnias requires a multidisciplinary approach with a focus on addressing any underlying causes or contributing factors. Treatment strategies include behavioral and environmental interventions, such as taking safety measures, securing the sleep environment to prevent injury, like locking doors and windows or removing sharp objects. Then, maintaining a consistent sleep schedule, avoiding caffeine and alcohol close to bedtime, and creating a restful sleep environment might be beneficial. And techniques such as mindfulness and relaxation exercises are used to reduce stress and anxiety. Finally, lifestyle modifications include identifying and avoiding factors that might precipitate parasomnia episodes such as sleep deprivation, irregular sleep schedules, and certain medications, and engaging in regular physical activity, which can promote better sleep quality and reduce stress. Pharmacological treatment for non-REM parasomnias include benzodiazepines, such as clonazepam, and certain antidepressants, which reduce the frequency of episodes. Medications used to treat REM parasomnias are melatonin and clonazepam, while prazosin and certain antidepressants can be effective in reducing nightmare frequency and severity. Targeted therapies include cognitive behavioral therapy for managing stress and anxiety, which may be triggering parasomnias, and image rehearsal therapy as a form of cognitive behavioral therapy specifically designed for nightmare disorder, involving the rewriting and rehearsing of less distressing endings to nightmares. Another disorder that we will discuss today are movement disorders of sleep. These are abnormal movements that occur during sleep, impacting sleep quality and overall health. Some of the most prevalent movement disorders are restless leg syndrome, periodic limb movement disorder, and bruxism. Restless leg syndrome is a neurological disorder characterized by an uncontrollable and irresistible urge to move the legs, usually due to uncomfortable sensations. These sensations typically worsen during periods of inactivity, especially in the evening and night, leading to sleep onset and maintenance disruptions. The exact cause is unknown, but genetic factors, iron deficiency, and dysfunctions in dopamine pathways are implicated. Symptoms include tingling, aching, or itching in the legs relieved by movement. Periodic limb movement disorder is characterized by repetitive, involuntary limb movements during sleep, often involving the legs. Stereotypic jerking or cramping movements occur every 20 to 40 seconds exclusively during sleep, possibly leading to frequent awakenings and resulting in disrupted sleep quality, non-restorative sleep, and excessive daytime sleepiness. Bruxism involves involuntary grinding or clenching of the teeth during sleep, which can lead to teeth wear, jaw pain, headaches, and disrupted sleep. It can be associated with stress and anxiety, being more frequent and severe during periods of increased stress. Diagnosing movement disorders of sleep typically involves taking a detailed medical history and performing specialized tests like whole-night polysomnography. Sleep diaries and also heteroanamnestic data might provide important insights in symptoms and facilitate the diagnostical process. Treatment strategies include behavioral interventions, medications, and lifestyle modifications. Behavioral interventions encompass maintaining a good sleep hygiene with a regular sleep schedule in a restful sleep environment and avoidance of stimulants before bedtime. Cognitive behavioral therapy as a structured psychological support program helps individuals change thoughts and behaviors that negatively affect sleep. Medications used to treat movement disorders are dopaminergic agents such as pramipexole or ropinirole for restless leg syndrome and muscle relaxants or anticonvulsants for periodic limb movement disorder. Of course, iron supplementation is prescribed if it is needed. Lifestyle modifications primarily include diet and exercise, since it has been shown that regular physical activity and a balanced diet can improve sleep quality. Stress management, in which techniques such as meditation, mindfulness, and relaxation exercises are used to reduce stress levels, also has been shown as beneficial in treatment of movement disorders of sleep. So, to conclude, both parasomnias and movement disorders of sleep are complex and require a multifaceted diagnostic approach and personalized treatment strategies. By combining behavioral, environmental, and pharmacological interventions, patients can achieve significant improvements in their sleep quality and overall well-being. Understanding these disorders is crucial for healthcare providers and patients, and ongoing research and advancements in sleep medicine continue to enhance our understanding and management of these intriguing disorders. Thank you very much for your attention.